Now that you know where your pelvic floor is and its role in birth, it's time to begin the first exercise in preventing tearing during birth. I call this the pelvic floor release breathing. The pelvic floor and the respiratory diaphragm work in synchrony. When one moves, the other does the same, just like a piston. Down together, up together. When you breathe in, your lungs inflate, your ribs expand out and up, your belly rises slightly, and your pelvic floor relaxes and lengthens downward. When you exhale, your lungs deflate, your ribs come down and in, and your belly and your pelvic floor shorten to resting state. If you place your right hand at the level of your lower ribs and your left hand at the level of the pelvis, as you inhale, both hands will move downward. When you exhale, both hands will move upward. This is the movement you're looking for to replicate in your pelvic floor. So inhale, exhale, inhale, exhale. This is a handy technique to tap into during birth to assist the descent of baby and opening of the pelvic floor. Since the pelvic floor moves with the respiratory diaphragm, you can use your breathing to release tension and assist in the lengthening for birth. You do this with the inhale. If you are able to feel your pelvic floor relax and move downward while you inhale, it improves your chances of not tearing. This is because the pelvic floor is meant to relax and lengthen to expand the lower rim of the pelvis as baby descends and out during birth. So what you want to do is get into a comfortable position to begin with. You can place a hand on your perineum or the sit bones to give yourself a cue of where you want to breathe to expand. Inhale slowly through your nose, allowing the breath to reach all the way into your pelvic floor. Picture your pubic bone and your tailbone moving away from each other. Picture your sit bones moving away from each other, all from the pelvic floor lengthening down and out. This is a controlled bear down. Do not hold your breath. Allow the breath to move the tissue. As you exhale slowly out your mouth, let the tissues of the pelvic floor and your belly gradually come back to their normal resting state. Because you are likely to be in multiple positions during labor and during birth, you're going to want to practice this in multiple positions. I've given you other handouts and videos to go over these positions to practice with.